Partnerships with community stakeholders have been essential to combating the COVID-19 pandemic. To highlight these community-wide efforts, AHA has launched a new series of resources, Joining Hands for Greater Impact. Over the next few months, we'll be sharing the stories from across the country of how hospital community partnerships have addressed urgent community needs throughout the pandemic. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. Today's podcast features how Esperanza Health Centers, a federally qualified health center in Chicago, has worked to keep their community healthy throughout the pandemic. This podcast was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. It's moderated by AHA's Julia Resnick, Senior Program Manager for Strategic Initiatives. She is joined by Esperanza CEO Dan Fulweiler and Ofelia Figueroa, their lead contract tracer. They discuss how Esperanza has engaged their primarily Latino community to increase vaccine confidence and access. Julia, over to you.
Dan and Ofelia, I'm so glad to be talking with you both today. Let's start with some background on Esperanza and the community that you serve.
Well, it's great to be here, Julia. Thanks so much for having us. Esperanza has been around for 15 years. Actually, we had our quinceañera last year, which was a big 15th birthday party, which was pretty great. And we have 5 primary care health centers serving the southwest side of Chicago. Because the southwest side is mostly Latino, our patients are as well. And about 95% of our patients are Latino, and about 70 to 80% prefer to speak Spanish with their provider. So we're working with a lot of recent immigrants to the United States, as well as their children and families, and that's who we really primarily serve. We're in some of the hardest hit communities in Chicago, and it's been great to be here offering this.
Can you tell us a bit more about the health inequities that you've been seeing among your community, especially during COVID-19?
Health inequities have been huge in these communities for a long time. First of all, about 30% of our patients are uninsured, and about 60% are on Medicaid. Only 10% have either Medicare or private insurance. And we serve everybody regardless of ability to pay. That's really our mission. And of course, during the pandemic, it's become even more important because a lot of people who didn't normally need to go to primary care, I think especially like young adult men who maybe aren't attached to, women are attached to an OBGYN many times for birth control and those issues, but a lot of men don't go to the doctor ever. And those men have been coming out of the woodwork actually and uninsured. And so our uninsured rate has gone up to 50%. And it's been really great to be there for them. The health inequities are drawn out not just in that, but also in all kinds of access issues, as well as just how it's been hitting the community. We're in 3 of the 5 highest hit zip codes in the state of Illinois. And so our positivity rates for COVID at our testing site have always been at least twice as high as the citywide rate. So at the height, we were doing 400 tests a day just at little old Esperanza. And at the height of positivity, 70% of them were coming back positive. So it was very high. At this stage, we've done 40,000 tests since we started in March. We actually had our first positive case on the same day that Governor Pritzker had named the shutdown. And our overall positivity rate for those 40,000 tests has been 20%. So we've diagnosed over 8,000 people with COVID. And those numbers are really pretty staggering, considering that on an annual basis, we only serve 45,000 patients. So almost 20% of all of our patients have had COVID. And that plays out in their daily lives. I mean, everybody on the Southwest side knows somebody who has COVID or knows somebody who's died from COVID. And that's a really tough thing, both for the community as well as for our caregivers who are obviously have been feeling pretty overwhelmed by this.
Ofelia, anything you wanted to add there?
Yeah, there's definitely a lot. We're seeing a little bit of everything. Obviously the population that we serve, they have a lot of barriers. Just in general, whether it's like language, access, they're getting most of their information from like social media or from the media. And very inaccurate at times. So then that just strikes more fear instead of like being useful information or educational information. A lot of the information comes secondhand, and we're definitely trying to, I guess, like bridge that gap and provide like the close attention and a lot of one-on-one with our patients. I think we're very lucky to have our own contact tracing department within the clinic. And this really allows for us to spend more time with our patients one-on-one. And we do a lot of phone like outreach, and just we connect patients to services, whether it be that follow-up for COVID, whether it be resources in the community. I know that we've seen a lot of our patients, because we serve like an underserved community. We see patients that are struggling just to feed their families. That has been a very big issue. Most of the time when we're offering resources, it's typically for food. Food is such a basic need. It's just unbelievable to think that our families that we serve are struggling to feed their families. I think the families that we serve also live in these multi-generational homes. And it's very sad to see that the families we serve are just struggling in general, in all aspects, whether it's financial, the security of housing has been a very big issue, just everything that we can think of.
Yeah, and I think unemployment has been a real problem in, I would say, almost every household that we work with. Either somebody has lost a job or somebody has to go to work throughout the entire pandemic without being able to work from home because they work in an essential worker job where they can't do it. And that's sort of a combination of things. People have less income to begin with, so they need to go to work even more, but they're not working in jobs that are necessarily safe because they're going to have more exposure to other people. And so because they live in multi-generational households, then the person who is working to support the family will potentially come home with COVID and infect other people. They live in crowded housing to begin with, and so there's no room to self-isolate. So there's this sort of combination of factors that all together have really brought about these high positivity rates and these high numbers of infections.
So all of these factors make it all the more important that patients in your community get vaccinated. So I'd love to pivot a little bit and talk about your vaccination strategy and what you're doing to get shots in arms.
We have to date given over 70,000 doses of vaccine, which I am incredibly proud of the team that really pivoted. Every single aspect of it was difficult, I just have to say. We knew from the beginning, because we had so many positive patients, that we needed to pivot quickly in order to offer vaccines. And that was going to be a big load for us because as an organization, we only have 200 employees. Well, at the time, we had 200 employees. Since then, we really rapidly, within about a month or two, hired 93 new people. So we've grown by almost 50% in just a matter of a couple months in order to provide the vaccines that we needed to do. And it was actually a pretty simple calculation. We knew that all of our patients were high risk because they're almost all essential workers. And so we divided out. If we want to get them all vaccinated within 4 to 6 months, which is the goal for high-risk people, how many shots are we going to have to do a day? And how many are we going to have to do a week? And so we set a goal of doing 8,500 shots a week, which is a pretty lofty goal considering that as an organization, we only do about 600 primary care visits a week. So we've more than tripled our total throughput as an organization. And that has really stressed all of our systems. The call center is, working overtime with a lot of extra people in there taking calls. The billing system, unfortunately, we have to bill for these visits because there isn't grant money to fund this. And so all those systems have really been stretched. We also needed to get space. That's been both heartening and problematic. We rented a former Blast Fitness facility in our neighborhood that's been empty for 3 years. It was great to bring life back to that site, which was really exciting because the business couldn't make it. It's been vacant and now there's life there. It was a struggle for us to find the space, but it was great to bring life to it. Another thing that's been amazing is we've worked with one of our local schools, Noble Street Mansueto High School, and they opened their gym to us, and we've been there for 4 months now, I think, vaccinating people, 700 people a day there. It's been great to work with these community organizations. We set this lofty goal, we've been hitting it, and we couldn't have done it alone. I mentioned this local school, that was really important, but maybe even more important were some of our CVO partners, our community-based organizations. So we're currently working with 5 different community-based organizations who are providing us staffing to do this work. And they're doing a bunch of different things. So I should actually name them because they deserve names. We're working with Enlace Chicago, Latinos Progresando, Gage Park Latinx Council, Southwest Organizing Project, and the Brighton Park Neighborhood Council. And we're a community-based organization too, so we have pretty good roots, but most of our work is really focused on the exam room and behavioral health and things like that. What these people do is they're doing like everyday outreach into the community. They're running food pantries, they're running educational programs, they're running social service programs. And so they have these deep everyday roots with people. And we have hired dozens of their staff members, or we're paying for dozens of staff members on their payroll to do work like taking phone calls for us in our call center, working on our cool texting system that we have to text with patients about appointments. They're also registering patients at our vaccine sites. And then they're doing outreach in the community. So door-to-door knocking, putting door hangers on doorknobs about vaccines. That work has been incredibly fruitful and something that we hope lasts well beyond the pandemic.
Yeah, and just to add to that, it's funny because we have multiple departments and we're all trying to combat COVID in our own different way. We have to remember that there's some organizations that are very vocal, but there's also organizations that might be smaller that don't have like that access or just might not know. So then we are doing more on the ground work also and connecting with them directly. We're visiting food pantries and churches and registering on site for appointments so that you're just building trust just by that, just by being present in the hardest hit communities. And they're very shocked that we are able to do this. Visiting areas that we know have people that might not have access to the technology or just might not know where to go, or the language barrier in itself, it can be very, very stifling because people don't know where to find the help. And we do have it, right? It's in the community. It's just a matter of like spreading the word and getting out there, right? So we're definitely about to hit the ground again with like the flyers and the door-to-door and visiting some of these like highly populated areas within our community. So it's exciting to see how much we've grown and how much effort that we're putting into the neighborhoods that we live in. I myself live in Brighton Park, which has been probably, I think, one of the highest zip codes that have been affected. And I see it every day. You go to the grocery store and the stores are packed. The employees are there. They're at higher risk. And I tend to say, have you been vaccinated? And I've gone to the coffee shop. Are you vaccinated? And I'm like, if you're not, I can connect you. And it actually works. It definitely does work. And it seems like a lot of the people that work with us feel the same way, that sometimes just that word of mouth and that personal connection, you can like affect people's way of thinking. And it's that opportunity to talk one-on-one and say, well, I work for this clinic for Esperanza. It's a great organization. Would you like to get vaccinated? We have to keep spreading that message.
I think that's a really key point, Ofelia. I was working at one of our sites registering people one day, and a woman came in and she almost welled up in tears and said, "Thank you so much for being here. I feel like this vaccine really wasn't for us, wasn't for our community. And the fact that you're here doing it gives me so much hope that we have access to this kind of thing too." So there's that part that like people are like, well, I don't want to go to the United Center. It's too far away, a huge mass vaccination site a long ways away. I can't get time off work. I can't arrange for childcare, all of those things. And then there's the other side of it, which is just that people have questions they want answered. And like, if you have to make an appointment to go to the suburbs or go to the United Center somewhere a long way away, and you don't even know yet if you want the vaccine when you go, why are you going to do that? Like, you need to have the conversation first on the ground. And that's what Ofelia and her team are so great at. They can talk to the people in their language. They grew up in the neighborhood. They know where resources are. They can make those connections and talk about the vaccine in a way that people can understand and really answer those questions one-on-one.
Yeah, being that trusted messenger is just so important. Can you, Ofelia, talk a little bit about what some of those concerns or hesitations are and how you've made people feel more comfortable in getting the vaccine?
The team that we have are all bilingual. And that communication, it's at their level, right? We're speaking the language. We live in the community. I want to say 90% of our team lives within the community, whether it's like Pilsen, Little Village, Brighton Park. So that just kind of, it helps build the trust, especially when someone is concerned about like, oh, well, the government's this and the government that, they're not here to support us. The city hasn't reacted, or, they're not funneling any of the resources in the communities. We understand that there's like difficulties, but there are services available. It's just a matter of connecting to the right people. And well, Esperanza is the right people, because we can connect you to just about any service that you might need. So once we do get you through the door, this is a one-stop shop. It really is. I mean, we have our own food pantry going here, like I think for this past month. There's other programs that are going to get started as well. What's very important is that our team, we sit there and we listen, right? We're not just trying to give you information, but we're trying to like receive the information and hear what your needs are and allow you to express yourself. A lot of these people have been isolated for months. All they get their information from is from the TV or social media. Now you're connecting to people that are working in this field, that have some knowledge, have been trained, and they speak my language. You would think that wouldn't be so important. It really is. The simple fact is that our team is bilingual and they can communicate and just express themselves and have that other person understand because I live it too, right? So I can relate to what you're feeling. What are the fears though? The biggest fears is like the cost, right? People feel like all of this is going to be very high cost and are not necessarily understanding that it's free. Vaccines are free, right? They're going to be provided to you for free. And we still, when we're taking calls, that's the big question. How much is this going to cost me? And if that's the train of thought of someone that took the initiative to call, I can't imagine the people that are not even calling. Like, what are they thinking? They're probably like, oh no, this is just too expensive for me. I can't afford this. We've seen people wait till they're very sick before they even show up. And by that time, it's a little bit harder to get them back to their good health amount at that point. But it's a little bit of everything, just like the lack of communication and the update, right? The full transparency also, right? Just people continuing to speak with the truth of what are we here to do? How are we here to serve? And, a lot of the times I think the population that we serve, there's just so much mistrust from like prior bad experiences, right? Like whether they got a very big bill from the hospital or just bad experiences where if they spoke to you in a bad way, but, not Esperanza, we're here to serve. This is a passion for us. I think that's the great part is that everyone that works here is very passionate about what we're doing, and we're definitely here to serve the community. And I think that kind of just reaps out of us. Anytime when we talk to somebody, you're going to see it. You're going to see the passion. And when someone's being very receptive, it's easy to communicate. Communication is a big thing with us. And we do know that they typically are barriers, but as soon as they get in contact with us, we're going to help because we do build that rapport and they will continue to come back.
That is wonderful. And I can certainly feel the passion oozing out of you as we talk about this. So you started to get at this, and I want to just dive in a little bit more about what lessons you've learned in the course of the past year and change as you've been thinking about equitable COVID-19 testing and vaccines that you could share with other hospitals or FQHCs that are specifically looking to address the needs of Latino communities that they serve.
Well, first of all, I would say hospitals get all the attention, right? So especially at the beginning of the pandemic, everybody was like, oh, the hospitals. Super important, right? No question about it. And we needed to get all those systems in place. But I think a lot of times when people think of the healthcare system, they think of hospitals first. They don't necessarily think of their primary care doctor. Well, that can be okay in wealthier communities because actually hospitals have their own primary care systems. They're a huge network. In poorer communities, safety net hospitals very rarely have a primary care network. They actually rely on FQHCs to do a lot of that work. And so there's this bifurcation between the hospital and the primary care network. And what that means is that if all the energy on testing and thinking about that is going to, the hospitals are going to help us, the hospitals are going to save us. Well, they can't in this poor neighborhood because they don't have access to the patients through primary care. And so I think that's one of the big things that we learned during this is that FQHCs and other organizations that are providing primary care in poor neighborhoods really need to take some big steps to address a pandemic, which is an infectious disease and is going to hit the primary care system first. That was something that we recognized pretty early on, that our hospital partners were not going to do a lot of testing.
Can you talk a little bit about how you have partnered with hospitals?
The hospital partners have been invaluable, but their resources are so limited in our neighborhoods. So one of the things that we've been very, very grateful for is that patients who come through our testing system are often quite sick. When I say quite sick, I mean extremely sick, very low O2 sats. We take O2 sats on all of the patients who we get tested. It's funny because a lot of places, when they're doing testing, they just do swab and go. But because our positivity rate was so high, we said swab and go isn't enough because we're seeing lots of really sick people. And we call the ambulance on a regular basis, multiple times a week, actually, from our testing site, especially at the height of our efforts. And one of the great things with hospital partnerships is we can call the ED in advance and say, we're sending this patient, this is his O2 sats. Sometimes we've even had a rapid antigen test result for them that we can give them as those antigen tests became available. All that information has been really useful and getting information back and forth from the hospital. I think the other thing that's been really useful with the hospitals is that they're referring patients to us for testing. And so while they were so stretched on the inpatient side, taking care of these really sick patients on ventilators and in the ICU and stuff, they couldn't do the testing. So they needed someplace to refer. And we were really happy to be able to take those referrals. So there's been a lot of great partnerships that have worked going back and forth that way. And we're super happy with our hospital partners.
Yeah, it seems like you play complementary roles.
Absolutely. But it is funny, though, how in underserved neighborhoods, in a richer neighborhood, that would all be one system, right? It wouldn't be referring back and forth from different systems. The medical group is doing the testing and the inpatient is doing the inpatient, and they all talk together and have the same EMR. And that's not the case in poor neighborhoods. And so there were some struggles, but I think everybody was really in it for the right reasons. And I do think the money came kind of late, but there was a decent amount of money. I'm hoping that going forward that there will be more investment in the safety net and understanding how it really supports the whole healthcare infrastructure.
And Ofelia, your lessons learned?
Well, for me, it's, I work with different, areas of communication for our patients, whether it's through the texting app and the phone systems. But I feel like a lot of the important work and the hardest reached patients have been on the ground. So, we've slowly moved into that where it's hey, visiting the churches, visiting pantries, passing out flyers, and moving forward, we want to do that even more. Right now it's been more of a slower process because we also want to be safe ourselves. But, we definitely are trying to move into doing more outreach, but to those, I want to say maybe organizations that might not have those partnerships, or the churches in the smaller neighborhoods or smaller community-based organizations. So we're definitely going to continue to work on that because we are reaching harder to reach community members. So it seems like that's kind of where we're headed. That's one of the biggest lessons that we've learned. There's so much that we can still continue to do. I think that there's still quite a bit of people out there that haven't been vaccinated. Being able to educate one-on-one is going to be more important right now. Since this is the first wave and everyone's okay, everyone that wanted to get vaccinated has gotten vaccinated, right? Now there's the people that really need to get vaccinated that we need to address. Those are the people that we need to reach out to, or the people that haven't been able to get connected to services. Those are the ones that we really want to target. There's still so many people out there that are very vulnerable, and we do have the potential to be able to make a bigger impact.
Yeah. So, that kind of gets to my closing question is really just what's next?
Yeah.
The pandemic's not over yet.
It's interesting because I know all the talk about vaccine hesitancy, Vaccine hesitancy is actually a term that I object to a little bit because I think at this stage anyway, we haven't dealt with the issues of vaccine access as well as vaccine knowledge and availability. And so that leads to sort of where we're going next, which is the things that Ofelia already mentioned, which is people in our communities are not dumb and they're not necessarily resistant or hesitant. What they are is isolated linguistically, or they're isolated from really quality sources of information, but they're definitely isolated from the overall medical system. These are a lot of people who don't have access to regular primary care doctors, who are relying on the emergency room for primary care and stuff, where they're not likely to get the kind of one-on-one conversations that really people need to have in order to trust this vaccine, especially given all the problems that we've had in the past with government interventions in healthcare of underserved people. So I actually think that where we're going is to more and more of what Ofelia is talking about. We have to be out in the community, on the ground, having one-on-one conversations with people in their languages from people who also live in the community who can say, my tia, my abuela down the street, she got it. And, I know she, and she didn't do well. She went to El Güero, the supermarket one day, and I think that's where she got it. And I can tell you that this vaccine has really saved, I feel like it saved my grandpa because of that. And like those literal connections, like people who know the community, who can say, these are the landmarks, this is where my husband got it, this is where my aunt works, all of those kinds of things, I think are really important to building trust. And there's no way to replicate that on a mass strategy. So we're going to be doing a lot of one-on-one, and I think Ofelia is excited about that.
Yes, absolutely. I mean, we're starting as of like this week a little bit more canvassing. We have been doing like food pantries and churches, but this will be more canvassing, talking one-on-one and talking to people that are at their place of employment where they might not be able to take the day off to come get vaccinated. But here's you go. We're going to schedule your appointment. You're at work. It's okay. Give me 2 minutes. I will get you all set up and you're good to go. And that's going to be our new strategy. Just really get out there on the ground and one-on-ones.
Yeah, I think this just really highlights the importance of meeting people where they are to get them where they need to go. So Dan, Ofelia, thank you so much for taking the time to talk with me and sharing the work that you're doing at Esperanza to get your community vaccinated. It's so crucially important, and we look forward to seeing how that work continues to grow.
Thank you, Julia.
Thank you for having us.
Thank you, guys. For AHA's growing repository of resources on the COVID-19 vaccine distribution, you can visit aha.org/vaccine confidence. Thank you to all of our listeners for joining us today.